AM 1060 WMEL. The views expressed on the following program are those of the hosts, callers, and guests, and are not necessarily those of WMEL staff, management, or advertisers.
This is Joe Steckler, folks, your host for Helping Seniors, the radio arm of Helping Seniors of Brevard County. Our job is to inform, educate, and connect seniors and those that care for seniors to the resources they need to help them age in place, to help them age with dignity, and to help them do it as gracefully and as easily as possible. Our phone number for our information specialist, and you can also get me on it too, is 321-473-7770. Calls are logged 24/7. Many times calls are returned on the weekend because we don't know how serious your problem is. If you call us, we're going to return the call. Luckily, Kay and I can do that because the calls come into our computers and we see what it is. And if you tell us what the problem is, many times it's necessary that we call you back, and we do that. We're only going to have a half-hour show today, folks. We're going to pick up the Rays baseball game at 1:30. But I do want to mention a couple of sponsors. One of the sponsors I want to mention is a new program called Organized Creative Designs. Carla has a program that she helps seniors downsize, helps you get moved into smaller quarters, and helps you make decisions on what are some of the things you need to get rid of, because she can measure the new place you go into and she can tell you what's going to fit. So you don't arrive at your new house trying to walk from table to table, and at 80 years old, that's pretty hard to do. It's not safe. It's not safe at all. But that's a good program. Also, Wendy Handy of the Space Coast Handy Pro. She is a Space Coast engineer who, with the downsizing, decided to do something different, and now she helps seniors design homes that are more compatible to them as they get older. And the last sponsor I want to mention is the Eye Institute, because that's my panelist today, Dr. Jason Darlington, who is with the Eye Institute. Welcome, Jason.
Thank you for having me, Joe.
Oh, it's glad to have you here. It's Dr. Darlington has done a television, at least 2 television shows with me, and the shows he did with me on television had to do with cataracts. So when I got the questions he wanted to talk about today on the radio show concerning glaucoma, I got to think, why does this guy want to talk about glaucoma when he talked about cataracts so much before? But I got to question number 7 or 8, and I saw why. But I'm not going to lead ahead of time here, and we'll just walk through this thing. But Dr. Darlington, what is so important about glaucoma, and what is it exactly, so our listeners understand what glaucoma is?
Glaucoma is a painless disease that happens in the eye, in which the optic nerve, which is the structure that carries visual information from the eye to the brain, slowly decompensates. And it's such a slow process that we cannot detect this damage occurring. And you can't feel it, you can't see it, but it's something that will eventually lead to blindness unless it's detected. Because it's painless, that's one very important reason why we should all have annual eye exams, so that we don't have glaucoma go untreated.
There's no way you can tell yourself whether or not you have glaucoma, is there?
That's correct. Even myself as an eye doctor, I would not know if I had glaucoma unless I had my eye examined.
It's I've heard it referred to as a silent killer.
That's correct.
It's kind of frightening because as I've gotten older, as my vision has sort of decreased, and my right eye is more blurry than my left. My left takes over and becoming the dominant eye. And if I shut my left eye when I'm driving, I realize that how important it is to have that good vision in both eyes. That's correct.
Yeah.
What are some of the things that, how do you treat it? How do you test for it first? I know you used to do the puff thing, but that's sort of gone by the board, hasn't it?
That's correct. Yeah, the puff test is a glaucoma test, although it's not an incredibly accurate test. These days, there are more efficient, better ways to check the pressure. But to rule out glaucoma, we need to do more than just check the pressure, because there are very different. There are many different types of glaucoma. In some types of glaucoma, the eye pressure can be in the normal range, and so we need to dilate the eye, look at the optic nerve to see if the optic nerve appears healthy. There are the pressure tests that we just mentioned. There are tests to measure visual field, because as glaucoma progresses and as the nerve starts to have damage, the peripheral vision is what's affected first. And so there are some special ways that we can test for peripheral vision loss.
You know, I get concerned because I realize how important my sight is to me, and most people do too. But so many people tend to weigh whether or not they have certain medical procedures performed, Dr. Darlington, depending on whether it's covered by insurance or whether they're 65 or older. Let's say if you're 65, if you're on Medicare, it's all generally covered by your Medicare insurance.
That's correct.
But how about the people that are under 65 and glaucoma? What is the youngest person you've ever seen glaucoma in?
Glaucoma can affect people at any age, starting from infants throughout their entire life.
See, now that's something I didn't know. That's why we do radio. That's why we talk about these things. Yeah,
there's infantile glaucoma, there's juvenile glaucoma, and then there's many different types of glaucoma that can affect folks of any age. The testing is, glaucoma is generally something that can be picked up on a routine eye exam without special testing. And then if it's determined that the optic nerve looks like it's starting to have damage, or if the eye pressures are elevated, then more special tests can be done by glaucoma specialists to determine whether or not there actually is glaucoma and whether or not it needs to be treated. Once the glaucoma is detected, there are a few different ways to treat. One is with drops, which the testing and the drops are covered by medical insurance because it's a medical problem, and there are also lasers. The nice thing about laser treatment for glaucoma is it only has to be performed once every 2 to 3 years, and it helps reduce the day-to-day burden of an additional medication. If many patients are already on multiple medications for other health conditions, they don't always want to add more medications. So a lot of folks will opt for the laser treatment, so they don't need to be on the drops.
Okay, when you came in, we were talking in the lobby before the show, and I said, Doctor, I kind of equate you to a surgeon of the eye, like we have general surgeons at the hospitals, and when somebody comes in banged up from an accident, they can cut on all parts of the body. You actually cut on all parts of the eye, am I correct?
That's correct. I perform incisional surgery.
It's an interesting thought, because let's say down at the Eye Institute, you have optometrists, right?
Correct.
The optometrist is the person that the general person would go into to say if I need glasses and get my eyes checked and see what prescription it would be. That's what the optometrist does, isn't it?
They do those exams, and they also can treat medical diseases as well. So there are they're able to treat glaucoma and treat infections and treat medical problems. And once the medical problem progresses to the point where incisional surgery is needed, then the patient would be referred on to someone like myself.
So what would make the Eye Institute different from, like, say, vision care, where they have an optometrist that you go into? What's the difference between the Eye Institute and vision care?
I believe at our practice we have more advanced testing capabilities and obviously access to surgeons like myself should the patient need more advanced surgical care.
Okay, so if a person came in to you all, and what is I don't know if you can give me an exact cost, but what's a ballpark figure? If somebody goes in and knocks on a door, goes into an optometrist's office and says, I'd like to have my eyes checked to see if I'm okay, if I got any problems, if I need glasses or not. What would it cost somebody to go and walk if they don't have insurance, if they're not 65 or over, if they're just younger people? What would it cost them, Jason?
I would have to hazard a guess, maybe $100 to $150 for an exam.
It's not very expensive.
Correct.
And I think sometimes we can just be a penny wise and a pound foolish in how we take care of our body. I have Dr. Sheldon, who is a periodontist on the radio and TV a lot, and we talk about general care of the mouth. And so many people don't realize how many diseases are transmitted through poor care of your teeth. What kind of are there any studies out that show a relation or a correlation between eye disease and other diseases in the body? I've never asked an optometrist or an eye doctor that question.
There are eye diseases that there are many diseases that can be seen or detected through an eye exam. For example, diabetes, which is a very common disease, has manifestations in the eye that we can detect. And in fact, anyone that has diabetes needs to have an eye exam on an annual basis or more often, depending on how poorly controlled the diabetes is. There are also other diseases such as high blood pressure can affect the eye and the retina. Some embolic diseases, problems with the heart where blood clots or cholesterol plaques break off and flow through the body and can land in the eye. So there are many different types of general medical problems that will have manifestations on the eye.
That question, how long does it take to become an eye doctor? How many years?
Approximately 10 to 11. 11? Depending if you do fellowship, which I did.
Holy smokes. I can see why you'd want to get into a good practice. Let's go back to glaucoma, though. What are some of the new procedures for treating glaucoma? I think it's interesting people know. We can do something if it's caught, right?
Yes, we can. So like we mentioned before, the initial treatments include glaucoma drops and glaucoma lasers. If those treatments fail to control the glaucoma, then incisional surgery is needed. For years, we've performed incisional surgery to create a new drain in the eye. One of those would be a trabeculectomy, in which we create a new drain using the body's own tissues, or there is a tube shunt that can be implanted into the eye, which diverts the flow to a plate, and that helps lower the pressure. Some of the newer procedures are what we call micro-invasive glaucoma surgery. The micro-invasive means we can do these surgeries through a very, very small incision in the eye, and the goal of these procedures are to help increase the efficiency of the natural drain so we don't need to create an entire new drain. And some of these newer procedures that I perform, one of them is called a Cahook ab interno trabeculectomy, in which I make a micro incision in the cornea. I go to the natural drain and I unroof it, and that helps the fluid in the eye have better access to the natural drain. It helps lower the pressure. And it's one way that we can control the glaucoma.
So many people, Doctor, are terrified of thinking about a dentist sticking a needle in their gums. And here you are. I've talked to you. This is the third or fourth time that we've been together on a show, on radio or TV. And you making a incision in the eye sound like it's so simple. Is it that simple?
It is a very, the eye is a very delicate organ, but if you perform these procedures in a delicate way, then it's very easy to perform them in a safe manner without damaging other structures. All these procedures that we do are performed under an operating microscope, so everything is magnified, so we can see all the different structures that we need to. And for example, the microinvasive glaucoma surgery that I just mentioned, the Cahook the hook blade, I can perform that surgery in about 3 to 4 minutes in a way with topical anesthesia, and the patient has no discomfort.
I have people that are just terrified thinking about needles and things, and I know these people. When I would talk to them, or if I talked to them, I think of one lady in person, if I talked to her about cutting on the eye, the first thing she'd say, her eyes would go wide open, and she'd say, "No way." And it's amazing to me that you make some of these extremely delicate procedures sound so simple. And I think that's one of the reasons why I get excited about doing shows like this, because so many people don't understand that these very complicated procedures have become much easier to understand and perform through the equipment that you have now.
Yeah, the advances in the technology is certainly exciting, and I can tell you in terms of cataract surgery, which is a very similar type of incision and some of the movements as the microinvasive glaucoma surgery. Those patients almost always have the cataract surgery in one eye, and then a week or two later have the cataract surgery in their second eye. People are always nervous to have their first eye done because of what you just mentioned, the thought of surgery on their eye, the thought of incisions and so forth. And in a vast, vast, vast majority of folks go into their second surgery relaxed because they've had it before. They know it's not going to be painful. They know what to expect, and it's something that they understand is like you said, it's a fairly routine procedure with a very low risk, and it's something that improves their, at least in cataract surgery, improves their vision and is very helpful.
When you do eye surgery, do you mentioned putting drops or the way you deaden the eye? Do you ever do surgery with the eyes with people asleep?
It would be incredibly rare to need to put someone under general anesthesia, which I think is what you mean by asleep, where you have to, put them in such a deep sleep where you have a machine breathing for them. All of the surgeries that I do are performed under conscious sedation, which means the patient is awake, the patient is breathing on their own. The patient does get some IV sedation so that they are nice and relaxed. And if they are still nervous, then we just give them a little bit more of that IV sedation until they are relaxed. But there is no need to put someone completely asleep for these procedures, because the risk of putting someone to sleep under general anesthesia, that has its own risk profile, and that risk profile is higher than just keeping them awake. And so most patients are very, very comfortable with just minimal IV sedation during these procedures. And like we just mentioned, if you're talking about a surgery that only takes less than 10 minutes to perform, that 10 minutes actually goes by quite quickly for the patient once they've received the IV medication.
Dr. Darlington, you are probably about half the age I am. Have you ever thought about older patients like me that go back and think about, we've watched all these advances in medicine, and I'm more familiar with them than many people, and many of the doctors I've had on my show have said that, simply because I've done so many different shows and I've had to do study and research to understand what my guests were going to say so that I understood what you're talking about to some extent. But I'm sure that you probably, it's occurred to you, do you ever have a concern about people that are in their 60s, 70s, and 80s understanding that something could be done for them if they came in to see younger doctors like you? You ever think about that?
Yeah, and that's one reason why we do these outreach programs like this radio show, and like our, and like the videos that you and I have shot before. The purpose is to make sure that folks understand that there are diseases that can be prevented if they will go in and have preventative care performed, and at those visits we can educate them on what the possibilities are.
Let's say We've only got 2 minutes left, and I got to ask a question because I've got cataracts, and you're a surgeon. Let's say I decided to have my cataracts removed, and there were problems. Are there any problems that you've seen pop up during cataract surgery that you couldn't correct, like retina replacement, lens replacement? You generally put a new lens in when you do a cataract surgery, don't you?
That's correct. We take the cloudy cataract out. The cloudy cataract is the natural lens, and we replace it with a perfectly clear lens. We cannot replace the retina at this time, but if the retina is having issues, then there are retina repairs that can be performed, and we have 2 very good retina specialists in our practice, Gary Ganaban and Dr. Vashnoff, who you've talked to in the past, and they can do many, many wonderful things with the retina to get the retina to work better if there's a retina issue.
We're almost out of time. What would you tell our listeners as something you, as an eye surgeon, think they should do about taking better care of their eyes?
Well, the most important thing they can do is make sure that they have an annual eye exam so that if the silent killer glaucoma is happening in their eye, it's detected early, because any damage that occurs from glaucoma cannot be fixed. We cannot regrow the damage that happens in the optic nerve. So if we detect it, we can treat it and prevent damage.
Okay. One question, one thing that you had listed, I forgot to ask about. If somebody has this special surgery on their eyes, and before they had all this eye drop stuff they had to use, do they still have to use those eye drops after the surgery?
Depending on how advanced the glaucoma is, many times we're able to eliminate the need for glaucoma drops following the procedure.
Wow. We're out of time, and so we're going to close. But I want to thank you, Dr. Darlington, for being so informative about glaucoma and telling a little bit about cataract surgery, because I know a lot of people worry about this. And I want to thank you, listener, for listening to us today. We'll be with you for a full hour next week. So enjoy the baseball game, and but all is well. We're starting to sell tickets probably in the 2 weeks with the 1992 Jaguar, and it's a great car. So we'll be talking